Heard at Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Heard at Health. I am Arundhati Parmar, Editor-in-Chief of MedCity News, and today I have with me Dr. Jeff Jacques, Chief Medical Officer of Personify Health. Welcome to you, Jeff.
Thank you so much. A pleasure to be here with you.
So there are so many care navigation companies out there. I know you do things that they don't do, but I still wanted to ask you, how do you see yourself to be different from them, and why should employers come to you?
Yeah, I think the important thing to remember is that Personify Health is actually two companies that came together about a year ago. One, Virgin Pulse, a global leader in employer well-being, and HealthComp, the largest independent TPA in the country at the point in time that we merged.
I see.
Pulling together, what we do is really we bring the best of our engagement platform, an ability to personalize experiences to an individual, help them discover their benefits, help them take steps towards their well-being, all the way to engaging with care delivery for themselves or a loved one. And we do that at a very high level of engagement. We're typically engaging 51% or more of a population because of the ability to personalize and use data to continue to personalize the experience. When I say engagement, I'm talking on average 19 times on platform per month, each of which really are opportunities for us to inform, help discover, find a benefit that is meaningful to them at that point in time, or help them engage in a journey maybe to better sleep hygiene or managing through a difficult parenting journey, all the way to weight management, managing blood pressure, and other programs. Everything that we have on platform is modular. And so the perspective that we have on navigation itself is, because the care delivery system and healthcare in general is so complex and opaque, one way that employers are better able to manage costs, which according to BGH have gone up 50% since 2017, is to support employees in making better quality and cost choices. As opposed to saying, I need a colonoscopy, or nothing, who did you go to and who did you use? Right. Actually look in your area, find a provider that provides you both high quality, but a cost that's not going to be ridiculous or too expensive. Right. You know, as an example, in the Bay Area where I live, a colonoscopy can cost you $800 on one side and $20,000 on the other. How do you figure that out if you don't actually learn to look? Right. And so one of the things that we really focus on is how do we help individuals have better experiences, better outcomes, and make better choices.
That makes sense. One of the things that I thought was really interesting when I was reading about your company is that not only do you provide care navigation, just like what you said, you know, steering the patient to the right caregiver at the right cost, you also do payment integrity, which is essentially your skill set in allowing employers to just pay the right amount for services that their employees seek and not overpay. I'm just trying to understand, was that the reason you had that skill set and developed it? Was it partly because, you know, employers have so many point solutions and they go to one company that does A, B, C, and D, and then payment integrity is done by a whole different set of companies, and care navigation, payment integrity don't normally meet. So I'm curious what led to bringing those together.
That's a really great question. You know, so many billions of dollars are lost every year to what we call fraud, waste, and abuse.
Yes.
And really what companies have been looking for over time and employers have been searching for is, how do you do fraud, waste, and abuse at scale? Again, all of our programs on the engagement platform are modular. If an employer wants, as part of our health plan administration services, payment integrity, we then combine AI-driven algorithms that scan multiple times through 100% of claims, as well as manual audits to find opportunities where inappropriate coding took place, and therefore pull back or refuse payment at the level that was requested. In a recent peer-reviewed journal, in the New England Journal of Medicine Catalyst Innovation Delivery Journal, they demonstrated that our AI-driven analytics actually saved $11.8 million over an 8-month period of time, just running silently and then pointing to specific opportunities for manual audit for our customers.
You mentioned fraud, waste, and abuse, but there are also things that are just expensive. For example, GLP-1 drugs, and you're aware that there's some employers that have decided that this is not for us at all, and there are some that are saying, okay, we will cover a certain section of the population that really, really needs it. How do you advise? What are your thoughts? What do you tell employers?
Yeah, GLP-1s have increasingly become part of my life over the course of the last year or so, largely because of members asking for help when it comes to access to GLP-1s. I've done extensive research internally, and I've spoken to over 60 customers just in Q2 of this year about where they are. These are consultative conversations around what are you doing, what are your thoughts, how do you structure them? And I will say, sadly or happily, depending on how you look at it, the $100 billion estimated by JPMorgan Chase of GLP-1 spend for weight management by 2030 is just the tip of the spear. There are so many other conditions where systemic chronic inflammation is a key component, both cancers, blood pressure, strokes, all kinds of conditions, that increasingly we're going to be looking at other indications being studied and potentially added by the FDA. My perspective is, after this year of research, study, talking to patients, doctors, and clients, is really you have to have a data-driven approach. Number one, what is the burden of weight health in your population? And number two, what do you want to do about that weight health challenge? Obesity and overweight are really an inflammatory process that leads to a plethora of cancers and other conditions. How do you want to approach that? If you're going to cover GLP-1s, we feel strongly that you must have behavior change programs in place that support membership who are either curious or desirous of a GLP-1 intervention. And I would go further to say that if you look at obesity medicine, there are 4 pillars: nutrition support, exercise support, behavioral support, and only once you have addressed those 3 do you then consider surgical or medical intervention, which GLP-1s would be part of. So I believe that over time we will come up with protocols that look at the normative distribution of who needs a GLP-1, who needs other therapeutics that are less expensive. I also think that the market itself will begin to respond to pricing, and therefore there will be some price pressure, especially as more compounds come out on the market. And we're always happy to consult with our customers or prospective customers and talk about solutions we can bring to bear. A few months ago, we announced that we had taken our digital therapeutic module called Transform and had added an entire GLP-1 arm to it to support individuals who are either curious or desirous of GLP-1s, supporting them for up to a year or more in that journey and helping them lose weight both naturally without medication and with medication if desired. We also have a very large ecosystem of over 70 partners. And so for customers who might want another alternative, we have excellent GLP-1 partners like Omada, Noom, Weight Watchers, among others, that are available on platform for our customers.
Yeah, it sounds like you're saying do a step therapy. Don't think of GLP-1s as a silver bullet, which I think a lot of people are sort of viewing it as.
Yeah, I think there needs to really be an approach that's methodical and data-driven, and I think that medication without first creating new skills and habits, resetting the behavioral relationship to food, nutrition, and exercise is a fail. You don't want to go straight to medication unless there are indications that where something really impactful from a health perspective could take place if you don't intervene.